personally like it when it's just the girls. I'm just going to say that. But when you have just the girls, you get a lot of specificity. Hi, everybody. I'm Wendy Bell. Welcome to Wellness Wednesday. We are at Advanced Integrative Medical 360, the McKnight Road office. And I am with the lovely and talented certified nurse practitioner, Alexandra Dubiak. Congratulations on your recent wedding.
Thank you. Thank you.
But more so, I love your knowledge here, and I think you really tap in with a lot of folks who watch.
I hope so.
Because you get into a lot of granular data, and I think it resonates with a lot of people. So without further ado, what on earth is going on over here?
I know. They made the mistake of giving me colored markers, so that's what happened.
It's organized. It's
It
organized,
is.
though.
It is.
So
It
go
is.
for it.
Yes.
What are we
So,
doing?
Today's topic is about prescription drugs and nutrient depletions. So, medications are very powerful and they're very important when it comes to helping patients manage their chronic health issues. However, they also, there's a number of drug categories that do cause nutrient deficiencies, and we don't really talk about that. So, a drug-induced nutrient depletion happens whenever the medications that we're taking for chronic health issues interfere with the absorption, the metabolism, the storage, the synthesis of nutrients.
Okay.
So, and it's very simple that we can just replace these things by taking different supplements or taking these things in different forms. So we'll go through that a little bit. So I just wanted to start this segment off with just a brief little section on some statistics. So I actually found this information on an article from the Mayo Clinic, and it was from a number of years ago. I couldn't find any good data recent, but this was from a number of years ago. So 70% of Americans are on one prescription drug, and this is a couple of years ago. 20% are on 5 or more prescription drugs. So, even though this article was from a number of years ago, I found it important to kind of point that out because this has only snowballed and gotten worse. And how do I know that? Because I read a ton of medical journals, and one of the most prominent things that comes up in these journals is polypharmacy. Okay, so taking too many medications, which multi, right? So it's a huge subject that they're constantly trying to teach pharmacists, prescribing practitioners how to get patients off of medications and to just keep prescribing more and more and more. So on that subject also, I found it interesting that women and the elderly are the most common among populations in different groups that are prescribed prescription medications. Women across multiple different categories of drugs receive more prescriptions than men, and guess what the number one category of drugs is that women? Antidepressants.
Oh, I was going to just say painkillers because
antidepressants.
I'm like, antidepressants.
Yes.
That's scary.
Yes. So, first one that I'm going to talk about is not a drug class, but it's acetaminophen, which is the generic name for Tylenol, right? So, overuse of Tylenol is one of the leading causes of acute liver failure in the United States, and I don't think most people realize that. It can be accidental, but it can also be intentional overuse of Tylenol. So, Tylenol is very well known to deplete glutathione, right? What is glutathione? Why is it important? Well, it's one of our most powerful antioxidants, endogenous antioxidants, which just means that the body makes it on its own, so that's important, right? Because it tries to take care of itself. So it's one of our most powerful antioxidants, and antioxidants are important because they help rid the body of toxins and free radicals, which cause a lot of cell damage and, organ damage. So very important. So Tylenol is metabolized in the liver, and it expends a ton of glutathione to try to neutralize Tylenol and make it less toxic to the body. So that's why that's so important, right? And people don't know that.
Sure.
So glutathione replacement, it can be given a number of ways. It can be given orally as an injection. We give it IV here in our practice, but it can also be given as an oral supplement. And actually a study that I read said that sublingual glutathione was found to be more beneficial than like an oral capsule that you swallow.
It's
so
just
that's
quick
just a
under
little
the tongue.
Yeah,
so right.
Exactly. So, next category is the acid-suppressing drugs, which is a huge category of drugs because everybody's on one of these or has been at some point in their life. So, acid-suppressing drugs are great because they help you they help get rid of your symptoms of what you're taking them for. However, they're very well known to cause nutrient depletions that we don't ever talk about. So first category there, H2 blockers, which you've probably heard of, histamine blockers in the stomach. So they block histamine receptors on the gastric mucosal cells, and it helps to decrease acid production and secretion. So therefore, can help minimize symptoms.
And you're talking about brand names we know.
Yep. Pepsid, Tagamet, Zantac, those are all examples of things. And you can get them over the counter. You don't even necessarily need a prescription for those things. So they deplete calcium, iron, folic acid, vitamin D, and B12, okay?
So wait a minute. I'm getting this feeling like our body's working against itself.
It is.
Okay.
One thing causing another.
Not the smartest person, but I'm just piecing
very
the
smart.
roadmap together.
You got it. Proton pump inhibitors, which we also call PPIs, they block acid transport. They block acid at the transport pump luminal surface. So it prevents acid from actually entering the gastric lumen, and that's kind of its mechanism of action of how it works to prevent symptoms. So your Nexium, your Prilosec, Dexilant, those are all examples of PPIs and probably not foreign names to you either.
No.
Very well known to deplete magnesium and B12. Antacids, another thing that people just go and buy over the counter. They directly neutralize already pre-existing acid in the stomach to help minimize symptoms. So Rolaids, Tums, Alka-Seltzer, all of those sorts of things. And they deplete pretty much all of the above and probably then some. There's so much literature out there about that, but everything. So.
Is this stuff all on that tiny little print on the box?
Right? Or do you literally need to come to somebody like you to realize that you're deficient in all these things, maybe because you're taking all of these?
Yeah. So, yeah, I mean, there are some of these things in the fine print.
Right, but now we know what they
But
are.
also, it's kind of just, you know, kind of just picking through it and what does make sense, the general progression of how this works. So, yeah, we get how these medications work, but what are they doing as a result of that? We don't think past that because people just care about their symptoms, right? But then they end up with more symptoms and it just snowballs. So this category of medications, the acid-suppressing drugs, realistically, they should never be used for chronic use. They're not made for chronic use. You know, I put somebody on a proton pump inhibitor, a PPI, in primary care. Hey, 6 to 8 weeks, and then let's come back, let's see how you're doing, and then you kind of decide at that point if you need to put them on a longer-term, you know, treatment plan, but they should never be used chronically. We should always be trying to focus on like, hey, what are the lifestyle modifications that we can make here? How do we help people lose weight, get to a healthier weight? How do we clean up their diet? Because, I mean, I want to say at least 90% of these people, if you help them do these things at baseline, they'll get rid of their medications. They won't need them anymore because it's their lifestyle that causes them to need these medications.
And that's why I talk about Advanced Integrative Medical 360, because you get this kind of information so you can get off the medication and start doing things that you want to do again, which isn't having a pill pack next to you.
Yeah, and this is just, we're just talking about nutrient deficiencies, not all the other side effects that can come along with it. Antibiotics, huge topic. Everybody knows and thinks antibiotics are bad. So antibiotics, how does this all tie into what we're talking about? So they disrupt your microbiome, right, which is just the trillions of good and bad microbes that each of us host on the human body every single day, right? So antibiotics, they indiscriminately kill your good bacteria along with your bad bacteria. They don't know the difference, so it kills off both, and it just throws off your balance, right? Of, I mean, the skin, the gut, everything, wherever you have these natural, you know, your natural microbiome. They affect gut transit time, motility, other colon processes. So it makes sense that if it affects all these things, particularly in the gut, and the gut is affected at baseline, and you're developing some inflammation because as a result of this, you're not going to absorb things. You're not going to break things down properly. You're not going to absorb things the way that you need to. So it makes sense you would have a nutrient, you know, deficiency as a result of that. So things that it depletes very commonly: calcium, magnesium, vitamin K, and some different B vitamins. But one of the most important things, if you absolutely have to be on an antibiotic, because we know that we need antibiotics for different reasons, if you have to be on one, take a probiotic, take a good one, make sure that it has lactobacillus and bifidobacterium, and then those are two really important ones. So simple, right?
I think I know why Dr. Dubiak loves you. Do you say these words all the time at home? You're like, hey, Darren.
Lactobacillus.
I can't even say it. I'm not even going to do it. I love it.
Next category, lipid-lowering medications, statins, which your husband is very familiar with. This is probably one of the most common drug categories that a patient comes in, sits down across from me and tells me, I never want to be on a statin medication. What can I do to avoid it at all costs? So, how do statins work? Their mechanism of action is that they inhibit this enzyme called HMG-CoA reductase enzyme, which just basically means that when they inhibit this particular enzyme, it blocks cholesterol synthesis in the liver, right? So it lowers cholesterol levels. Depletes, however, it is very unfortunate that coenzyme Q10, which we know as CoQ10, also requires HMG-CoA reductase enzyme for its synthesis and to produce it. So almost anybody that is on a statin drug is going to be deficient in CoQ10, why is that important? Because CoQ10 is another endogenous antioxidant that is super beneficial in neutralizing free radicals and preventing damage to the cells of the body, but it's also really important for the growth and maintenance of our cells too. So anybody that's on a statin drug, you have to be on CoQ10 supplementation. That's just how it is. But again, we should always be working on how do we get these patients away from these medications.
Right.
And your husband would know there is a population of people that absolutely have to be on statin drugs.
Sure.
No matter what we do, these people just have high cholesterol levels, and it's unfortunate that it's familial.
But let's make sure they're balancing themselves out by getting the nutrients that they need.
Right, exactly.
Okay.
So.
It's not making sense.
Yeah.
Right?
So next to last category, diabetic medications. So this is a huge topic.
Sure.
I'm just going to talk about metformin because mostly everybody has heard of that in terms of diabetes medications, and because it's one of the most common drugs prescribed for diabetes. It's actually the first line drug of choice in the treatment of uncomplicated type 2 diabetes because in primary care we consider it to have a really low safety profile. I don't know if I would agree with that in this setting, but it helps to control glucose levels and it has a lower risk of causing hypoglycemic events. So we use it a lot, but known to cause a B12 deficiency when it's used on the long term, which if you know anything about B12 deficiency can lead to anemia. So if it goes on long enough, if it's bad enough, patients can become anemic because of a B12 deficiency from a medication that they took. There's also growing evidence I put up there about that they suggest that it can also be linked to vitamin D, magnesium, and other B vitamin deficiencies as well. So there's tons of studies going on about that.
Gotcha.
So in terms of B12, you can always supplement it orally. However, I don't necessarily prefer that just because I feel like everybody at baseline has a lot of GI issues these days. So I prefer it in an injectable form just because it bypasses the gut and is better absorbed.
Makes sense.
Yes. Last category, anti-anxiety medication. So another huge topic, there's tons of different classes of anti-anxiety, antidepressant medications that we use, but I'm going to talk about the benzodiazepines here today. They're very commonly used. Everybody's heard of Ativan, Xanax, Restoril, Valium. They're common names, although I don't think we really use too much Valium these days. I think we've gotten away from that. But very, very, very well known to deplete calcium absorption. So that happens because it decreases your it increases vitamin D metabolism, which you need vitamin D to be able to absorb your calcium. So if you increase how your vitamin D is metabolized and it's not there to help your calcium be taken up, you're going to deplete your calcium levels, right? So if you have low calcium and vitamin D levels, guess what that leads to over time? You have a decrease in your bone mineral density. Well, what does that mean? Osteoporosis. And what does that mean? That high fracture risk and probably at a much younger age as well. So supplementing with, calcium, vitamin D supplements, you can do it orally, but they can also be taken in injectable forms as well.
So when we talk about what these folks do here at AIM 360, this is all predicated on your individual blood work. They can see all these things going on in your body and then create an IV that is natural, that is the good stuff that you need, that pumps up what you're missing because of various medications or lifestyle or whatever. And that is the true joy of what you do for people.
Yeah.
So how do they get in touch with you, or do you want me to give the phone number?
You can give the phone number.
412-227-9255, online, integrativemedical360.com.
Yep.
It's a lot to look at. But nobody, I guarantee you, has ever gone over it with you like this. And if your statistics are even remotely correct, which I'm sure it's an undershot, that means a lot to a lot of people.
Yes.
Thank you, Allie.
You're welcome. Thank you.
All right,
Appreciate
you guys,
it.
make your appointment. These people change lives. I mean it. Until next time, have a good one. Peace.
Bye.